Hello, I'm Dr. Kenneth Beer, board-certified dermatologist and dermatopathologist located in West Palm Beach, Florida. Welcome. Thank you for viewing this training video intended for use by investigators in the upcoming Voluma 006 clinical study. As you know, Juvederm Voluma XC injectable gel is indicated for deep injection in the cheek area to correct age-related volume loss in adults over the age of 21. The purpose of this video is to provide clear, concise training and instructions on this injection protocol for investigators in the Voluma 006 clinical study. You will follow the injection protocol outlined in this video and use as directed. Today, I will treat two subjects, one male, one female, with Juvederm Voluma XC in the chin area to demonstrate the proper injection technique for the chin and jaw area in this clinical trial. Please note that just as the initial mid-phase clinical trial focused on three specific subsections of the cheek region, this trial will focus on three sections of the jaw and chin regions. These sections are the pagonium, menton, and prejowl sulcus. Always cleanse the area with antiseptic or alcohol wipe before each injection. Wear clean gloves and change them after making contact with non-sterile items such as the hair, face, or product packaging. Do not touch or wipe the needle or microcannula or use your finger as a guide for the needle or microcannula. It is also critical to never dilute or expose the product. Let's begin with our female subject, Olga, who's 52 years old. We can assess her before treatment facing forward and then in profile position. While observing her profile, we observe her as a grade 2 or moderate. Observe as I inject the soft tissue pagonian or anterior aspect of the chin with the supplied needle in the supraperiosteal plane. Investigators in this trial can inject up to 3 boluses, each 0.5 ml or less in the pagonian. The injections may be performed using either depots or the cone injection technique, which is also known as the column technique. Insert the needle tip perpendicular to the skin surface and advance in an anterior to posterior direction until you contact the periosteum of the mentum. Just before injecting, the plunger rod should be withdrawn slightly to aspirate and verify that the needle is not intravascular. I then begin injecting depots or cones. Be careful not to inject into the mental artery, which exits the mental foramen. My goal in treating the pagonium is to achieve greater projection of the chin and bring it into balance with the lower face. So for the pagonium, for the first injection point, it will be right in the midline with a depot injection of 0.2 mLs. Then I'll do one injection off to the right lateral side and another to the left lateral side, each using a small depot supraperiosteally with about 0.15 to 0.2 mLs. After injection, you are able to gently massage or mold the gel. Repeat this process for each injection while constantly assessing the results the treatment is providing. As with all Juvederm Voluma XC treatments, correct to 100% of the desired volume effect, but do not overcorrect. I will now move on to injection into the menton, or inferior aspect of the chin. In this case, investigators can inject with the supplied needle or the provided microcannula supraperiosteally or subcutaneously using multiple small boluses of up to 0.5 ml per bolus. Again, make sure to avoid injecting into the mental artery, which is located laterally to the apex of the chin. It is important to always aspirate prior to injecting. To do this, I insert the needle tip and then withdraw the plunger rod slightly, ensuring that the needle is not intravascular. As I treat the menton, I will aim to taper the correction so that the treated area of the pagonian transitions smoothly below the chin. Additionally, I lengthen the chin for achieving proper proportions of the lower face. Treating the menton with these goals in mind can add to the overall aesthetic improvement of the treatment. When we're injecting the menton, we injected 0.25 mLs supraperiosteally in an inferior to superior approach. Now let's inject the prejowl sulcus on the left and right side. If injections to the pre-gel sulci are desired, investigators may use the supplied needle or the provided microcannula using a subcutaneous fanning technique. Again, always remember to cleanse before injection and, when necessary, gently mold after the injections. Structures in this region that must be avoided when injecting include the facial artery and facial vein. The facial artery crosses the body of the mandible and gives off the inferior and superior labial arteries. Treating the pre-gel sulcus can have several benefits. Whereas men may want a more square jaw with a wider chin, women generally prefer a more heart-shaped face with a narrow chin. So for women, I am careful not to widen the sides of the chin too much. Where needed, I will inject lateral to the chin to taper the correction of the pygonium for a smooth transition to the sides of the chin. And lastly, I add product to reduce the severity of the pre-gel sulcus. All of these can improve the aesthetic results of the chin treatment. After making a small incisional entrance with a needle, I'm using a small cannula, inserting through the opening and then doing a fanning technique, going up, middle, and down to treat the pre-gel sulcus. In total, I use 0.25 mL of Juvederm Voluma XC in this area. So on her left side, I made an entrance incision with needle here, and then I used a 1-inch cannula using a fanning technique to deposit 0.25 mL of Juvederm Voluma XC in the lower, mid, and superior aspects of her pre-gel sulcus. The appropriate volume for each injection will be determined by the investigator, but the total amount injected in the 3 regions of the chin and jaw should not exceed 4 mL for the initial and touch-up treatments combined. Moving on to our male subject, Stephen, age 65. When injecting the male chin and pre-gel area, it's important to recognize that males have a very different aesthetic endpoint than females. The male chin should be more horizontal and less tapered. Males should not have an endpoint of having a heart-shaped face. Instead, they should have this type of horizontal aspect to the inferior border of their chin. In profile, the chin should be a little bit more projected in a male. Assess before treatment facing forward and in profile view. While observing his profile, we observe him as a grade 1 or minimal. After having cleansed the injection areas, I can begin injecting the pygonium with the supplied needle in the supraperiosteal plane by inserting the needle tip perpendicularly until contacting the periosteum. First, I withdraw the plunger rod slightly to aspirate and ensure that the needle is not intravascular. I then begin injecting depots or cones using up to 3 boluses of 0.5 mL or less per bolus. When injecting male patients, it is important to consider that they have a different endpoint and usually want a more square chin rather than one that is heart-shaped. This means that injections should be altered so that slightly more material is injected in the lateral injections than when injecting a female. So for the central aspect of the pygonium, here I injected 0.2 mL, and for each of the lateral aspects, in order to give the more horizontal shape, I did 0.15. So the total for the central pygonium area is 0.5 mL. Again, it is important to always aspirate prior to injecting. I begin by inserting the needle tip and then withdrawing the plunger rod slightly to ensure that the needle is not intravascular. I then begin injection into the menton with the supplied needle or provided microcannula supraperiosteally or subcutaneously using multiple small boluses of up to 0.5 mL per bolus. In the menton area, using an inferior to superior injection technique, I inserted 0.3 mL of Juvederm Voluma XC. I will then fill the pre-gel sulcus again using a subcutaneous fanning technique with the supplied needle or the provided microcannula. And now, after the injection into the menton and pagonium, as well as the right pre-jowl sulcus. I'm gently massaging to make sure there are no lumps or bumps. In the right pre-jowl sulcus, after introducing 1-inch cannula, I did an injection of 0.3 mLs of Juvederm Voluma XC in a superior, mid, and inferior orientation. In his left pre-jowl sulcus, I used a similar amount of volume, that is 0.3 mLs of Juvederm Voluma XC. I used it in an inferior, mid, and superior orientation using a fanning technique. As you can see, we achieved a very nice correction of his pre-jowl sulcus volume deficit. When looking at his chin, you can see that he has a much more defined jawline and chin. His projection is now at or about the anterior aspect of his lower lip, and we've corrected a lot of the volume deficit that he had. So his lower face is now much more proportional to the middle, third, and upper aspects of his face. Summary of injection techniques. Pagonium. Insert the supplied needle perpendicular to the skin surface and advance in an anterior to posterior direction until contacting the periosteum of the menton. Then inject supraperiosteally with up to 3 boluses of less than or equal to 0.5 ml per bolus, using depots or a cone or column technique. Menton. Inject with the supplied needle or the provided 1.5-inch microcannula supraperiosteally or subcutaneously using multiple small boluses, each less than or equal to 0.5 mL per bolus. Pre-jowl sulcus. Inject with the supplied needle or microcannula using a subcutaneous fanning technique. After inserting the needle tip but before injecting, withdraw a plunger rod slightly to aspirate and verify that the needle is not intravascular. Correct to 100% of the desired volume effect. Do not overcorrect, and constantly assess results during the treatment. The total amount injected in the 3 regions of the chin and jaw should not exceed 4 mLs for the initial and touch-up treatments combined. When necessary, gently massage or mold after injection. This concludes today's training and instructions on the injection protocol for the Voluma 006 study injecting Juvederm Voluma XC to treat the jaw and chin areas.